as a supervisor, it's again going back to judge of character. You have to trust that you're bringing people on that are going to represent the company, and that are able to go into a patient's room and be respectful and mindful, but then also adhere to their obligation. So those obligations are, their time. Are they meeting requirements for their visits? So for instance, if somebody says, I'm going to visit my patient once a week, are they meeting those frequency visits? With those visits come the documentation forms that states that they were there, and then those visits get put into the patient's chart. Without them feeling like an employee, we try not to harass or, nag our volunteers, but sometimes you have a variety of people with different ways of doing things, and you have to send out reminders, and sometimes they don't always listen. And so that's frustrating because we have a time, we have to meet our deadlines of when the notes have to come in. So that's one obstacle that I face often. But for the most part, I have really good volunteers who respect that. So you have to speak up and set those boundaries immediately of what's required. And if you know that somebody is maybe a little bit late getting their notes in, or not meeting the requirements, then you have to be able to be open enough to talk to them and say, maybe this isn't right for you, or, maybe, cut down to a couple times a month so they don't feel like they're being obligated. And we go into guilt, and volunteers feel very guilty if they don't, meet those requirements, and then I don't hear from them, and then they go away and I don't know what happened to them because they leave because they feel bad. So I have those very open conversations from the beginning. Obstacles with with the volunteers and the patients. I had one story with a pet therapy volunteer who, from the beginning, I could tell that she had a very strong personality. She came off quite abrasive, and I thought, I'm going to give her a shot. And she went into the building, and within, I think, 3 months, I was getting complaints from the building, and we have to address it immediately because we are guests in the facility. And it was the dog that was getting a little aggressive. And when she was approached, she was then becoming abrasive to the staff in the nursing home. So it came back to me, and I had to have that conversation with her that I had to ask her to resign as a volunteer. And I was quick in doing so because I thought, this is my job, and I was okay handling and having that conversation.